Hello, everyone, and welcome to MSK Unknown Case Series, Case 78. We have an amazing case, so let's go ahead and get started. We have a coronal T1 weighted image through the shoulder and a corresponding coronal T2 fat sat weighted image through the shoulder, showing some dramatic findings here. And the question that I have for everyone is, what's the most likely diagnosis? Is this a full thickness rotator cuff tear, a case of bursitis, septic arthritis, or is this in fact a soft tissue tumor? What's the most likely diagnosis here? So if we come back to the images here, first of all, I think it's important to realize and recognize that there's a lot of osteoarthritis here, right? You can see marginal spurs and osteophytes along the humeral head here. Even at the acromioclavicular joint, we see inferior clavicular osteophytes that likely relate to and result in subacromial impingement. But importantly, a very salient finding here is the high riding humeral head. Notice that there's literally no space between the humeral head and the acromion. And not only that, there has been some subchondral sclerosis along the inferior margin of the acromion. This indicates that there's been rotator cuff arthropathy. So there's been long-standing rotator cuff arthropathy with a high riding humeral head. Oftentimes when we have a high riding humeral head that has been present for a very long time, that usually indicates rotator cuff tearing. And what we have here is we have this large fluid collection kind of in the supraclavicular space superior to the acromioclavicular joint. What happens in this case is you get a chronic rotator cuff tear that's a full thickness tear, so that fluid in the subacromial cell deltoid bursa eventually goes through the acromioclavicular joint because a long-standing cuff tear weakens this inferior acromioclavicular joint capsule, rupturing it, and then fluid then erupts into the supraclavicular space. So this is a nice example of sequela of actually a full thickness rotator cuff tear. And this is actually an important sign in radiology. This is known as the geyser sign. Have you guys heard of the geyser sign? Geyser. It's like a volcano erupting, and you get all this fluid that sort of erupts, just in the supraclavicular space here. And it can be dramatic. And this is not a common finding, but when we see it, it indicates that there's a full thickness rotator cuff tear because there has been a high riding humeral head with rotator cuff arthropathy, and there's a long-standing rotator cuff tear that occurs that's full thickness. It traverses the entire thickness of the rotator cuff tendon from the articular surface all the way to the bursal surface, right? And with time, because this rotator cuff tear is chronic and you start to get fluid pooling in the subacromial cell deltoid bursa because of subacromial impingement, this weakens the acromioclavicular joint capsule. And when that happens, the inferior acromioclavicular ligament tears or ruptures, and that allows fluid to sort of erupt through the acromioclavicular joint capsule into the supraclavicular space, and you get that large fluid collection that you saw in the index case. So this is known as the geyser sign, and it's like a volcano sort of erupting with fluid. A really cool sign. Hope you never forget it. If you see it again in the reading room or on an MSK MRI, think of a full thickness rotator cuff tear. Thank you so much for your attention. Please subscribe to the MedED page, support our mission in spreading knowledge globally throughout the world, free. And we'll see you next week for another high yield MSK unknown case.